My name's Dr. John Jackson. I'm an orthopedic surgeon. I went in the Army when I was 19. I was a medic in the Army. When I finished my tour, I went back to school, and at that point I had been around doctors. I knew what I wanted to do, and that's when I decided to become a doctor. I'm not one of those guys that when they were 12 years old, they knew they wanted to be a doctor. It really was getting the experience of being an Army medic that made me make that decision. I originally thought I was going to be a cardiovascular surgeon or a cardiologist. When I was an intern, I was on a rotation for orthopedics, and the very first day, they let me operate. And all I had to do was take some pins out of a knee. It was amazing. I had my hands in there, I was doing this, and I said, this is what I wanted to do. As it turns out, my dad and my grandfather were both carpenters, and a lot of orthopedics has something to do with carpentry, and so it was kind of a natural thing for me to gravitate into that. I came here in 1986. I had finished medical school. I had a scholarship through the Army. They sent me to El Paso. I didn't know where it was. The only thing I really know was the story about Rose's Cantina, which happens to be down the street from where I live. And when I got here, I just fell in love with it. I did my time with the Army. They sent me to Germany, and they sent me to Honduras and a couple other little places, but when I finished, I knew I wanted to stay in El Paso. It's just such a friendly town and a nice place to live. My wife is Hispanic, and so we've just this is our home now. I specialize in hips and knees. I do 90% of my practice is hip and knee replacements and complex reconstructions. I see a lot of patients that are referred to me that have had infections or their prosthesis has worn out or they've had some other complication, and I'm the one that fixes those type of problems. Some of the things that have come out over the last 30 years, instrumentation is much better. When I first started doing a hip replacement, it was a 3-hour surgery. Now it's about an hour surgery. Computer navigation has become utilized frequently. It helps us align the prostheses so they do better, they last longer, and the patients have better outcomes from that. That's probably the major thing that's come out over the last 10 years or so. In El Paso, a lot of the patients just think the doctors walk on water, and I think we have to show them that we don't, that we do have a gift, but that we're blessed to be able to take care of them. And so I spend a lot of time with my patients explaining to them, this is what I do, this is how I do it. Most of them got sent to me. I have a reputation now, having been here for all these years, and so it really makes it easy for me to be a physician here. And I tell my patients, please don't hesitate to ask anything. When we were in school, the teachers always said, the only stupid question is the one you don't ask. Well, that's really true. If there's something there and you just think it's dumb, don't think it's dumb. I've answered all these questions before. I know what they're like, and I think that you should feel comfortable doing that. I play a little bit of golf. I used to play a lot. I do a little bit of bicycling. I like to spend time with my family. I have a grandson here in town that he's 10 and he's into Little League Baseball, so we go see some of his things. I actually am a workaholic. I still work 50 or 60 hours a week and love what I do. I'm one of the few doctors that I know that can say, I look forward to going to work every single day. This is my life. This is what I was put here for. I'm not real religious, but I think God put me here to do this. When I was a kid, I wanted to be a professional basketball player. This is better than that. It's just that it's so rewarding for me. My patients respect me. They tell me all the time, thank you so much for taking care of me. There's a sensation that can't be explained when someone says to you, you gave my life back to me. That you can't just, there's nothing to explain that. It's just what they feel, and it makes you feel so good. People ask me, what is the best experience I ever had as a physician? When I was stationed in Honduras, we took care of the local people there. They have 5 orthopedic surgeons for a country of 5 million when I was there. One of my first patients was a 12-month-old with bilateral club feet, a deformity that children are born with. If you don't get them fixed, you can't walk. Well, I fixed that kid's club feet on the day or 2 days after I got into the country. I was just out of training. I literally had the book open next to me in the operating room while I'm fixing these. I was there for 6 months. After surgery, he gets casts, and we change the cast every few weeks. Just before I'm ready to leave, the mom comes in. The kid now is 18 months old and is running around the clinic normal. And I'm sitting at a little desk that's like a school desk. I'm writing my notes because we wrote notes back then. We didn't have computers. And I feel something on my feet. I look down and she's kissing my feet. It's the most humbling experience I've ever had in my life. It brings tears to my eyes when I think about it. But that's what I'm here for, is to take care of people. I never got paid a penny. And yet it's been a lifetime that I think about that almost every day.